Welcome, everyone. I'm Donald Weeks, founder and CEO of ClearPath AI and host to the Clinic Efficiency Podcast. Today, I'm joined by Martinien, founder of Mechi, an AI driven platform that addresses employee burnout, reduces turnover, which ultimately improves retention rates, and increases clinic efficiency due to knowledge retention. What stood out to me is how Mechi positions itself not just as a messaging automation, but as a way to help clinics recover revenue, reduce no shows, and improve patient experience at scale. Marty, welcome to the show.
I'm doing pretty good. Thank you for having me.
Great. Yeah, if you would tell us a little bit about yourself and your background and how you got started with Mechi.
Yeah, absolutely. My full names are Martinien Cho. I go by Marty. I have over a decade and a half in the healthcare industry. And really, most of my experience in the healthcare industry has been around nursing, as a nurse practitioner, a registered nurse. Now practicing as a nurse practitioner. Most of my experience really been in cardiology. And really got inspired to start Mechi, which is I'm the CEO and co-founder of Mechi, to really look at movement as medicine for people at a very prehab level, not waiting for people to get sick, not waiting for complications to arise before we treat them and then send them to a rehab facility. And, we're in the space now talking about, AI and healthcare and like where does this all fit, right? So, I mean, healthcare leaders are really investing heavily in AI to improve documentation, scheduling, and throughput, right? And that's critical. But for us, what's really important was not only workflow automations alone would really solve the big problems in healthcare. Clinician burnout, which is one of our main solutions that we are looking to address, is really, really paramount that we bring along, especially in this AI age. Burnout is not a soft issue. It's a financial liability. We want sustainable efficiency. We must actually optimize that both systems, both human and technology, are working side by side and not separate entity. Like one's not going to replace the other. It just can't work that way, especially when we're talking about healthcare.
Right. Well, you built Mechi around a very specific pain point, the operational chaos that comes from manual patient communications and follow up gaps. When did that problem really become clear to you? I mean, was there a moment where you thought, this is broken and it doesn't need to be this way?
I think like the direct communication with patients per se was not really the initial focus of our solution, right? I think the breakdown was just in the moment when you're trying to educate a patient, hey, you need to walk 20, 30 minutes a week for improving your blood pressure. In that moment, they're not hearing that, right? They're hearing, I have high blood pressure. What does this mean? Can I go to work on Monday? Right. And so then how do you maintain that sustainably over time and build something that's really integrative into their life and their lifestyle, such that is not another diagnosis, is not another intervention that they have to implement. It's just something that they can just bring along with them, along with their healthcare and overall well-being.
Right. Well, on your site, you emphasize AI powered automation, not just appointment reminders, but smarter engagement workflows. How are you thinking about automation inside clinics today? I mean, is it about replacing manual tasks, augmenting staff, or creating entirely new efficiencies?
Not exactly. I think the efficiency opportunity with AI is huge.
Hmm.
Yeah, healthcare inefficiency is heavily driven by administrative burden. We know that. Physicians spend nearly 2 hours on EHR and then maybe another hour on desk work. For every 1 hour of direct patient care, they're spending 2 hours for EHR documentation and follow up, right?
Right.
Administrative complexities accounts for an estimate like $260 billion annually in US healthcare, right? This is from Cutler. Kenzie also estimated we're spending, like, if we just implemented AI very, very efficiently, we can actually save approximately 25% in healthcare administrative costs.
Wow.
That's
Wow.
about
Okay.
$66 billion, right? So if you
Right.
really step back and say, okay, let's take something as documentation alone. If an AI-driven documentation tool can also function as a predictive scheduling, can also help with like workflow optimization systems that are already improving, say, visit throughput, revenue cycle, documentation, coding appropriately. So I'm not having to talk to the billing department, like, hey, did I bill this patient correctly? Did I put in the right ICD-10 code? Did I put in the right CPT codes? Then you are saving. That's how much money you can save just by improving some of those efficiencies. And then it always boils down to money, right? Like, let's just be honest. The big picture, But when it comes to CFOs, what do they want to hear, right? With hospitals, administrators, what does this mean to them? Like increased clinician capacity. That means that if clinicians are less burned out because they have more efficient tools, they have more, they're billing adequately, they're adequately compensated because we're not billing the wrong codes. Then we can increase capacity, we can hire more people, we can reduce more, like reduce overhead, right? Again, because I'm already billing very efficiently to begin with. So now I don't have somebody else reviewing to say, hey, did you build the right ICD-10 code for these diagnoses, right? And then the whole expectation is that over time, these margins will stabilize and you can actually now start to see a consistency in like revenue streams and workflows and things like that. But I do have to add that with a caveat of efficiency gains will eventually plateau and the workforce remains burned out, then all that is just kind of a redundant wheel, spoken wheel.
Yeah, it makes sense. Well, AI adoption in healthcare can be slow, especially in smaller or mid-sized practices. What's been most surprising to you about how clinic owners respond when you introduce automation into their workflows? Or do you?
I would
Yeah,
say, AI alone is not enough, right? And I think that's the hesitation that you get from all pretty much any, it doesn't matter what you're building. The moment it has AI in it, and, especially in the healthcare space where it feels like, wait a minute, is this like actual evidence based? Is this backed? Is this going to hurt my patient, right? So, first rule of thumb in medicine is do no harm, right? And so,
right.
sure, AI reduces cognitive and administrative burden, but it does not improve cardiovascular health, for example. It does not increase physical activity, does not reduce social isolation. It doesn't build community resilience. It doesn't improve lifestyle risk factors, driving claims. So how do you, which again, when we talk about health, we're not just taking the patient, the day of clinic, right? You really have to step back and look at it from a bird's eye view. And so these are all so many complex systems that are all interacting with each other. Social worker, case manager, the nurse practitioner, the physician, the specialist. How are all of those things interacting with each other to make sure that we're treating the patient the most efficiently and adequately in this day and age? Right. So, the successful AI tools are going to be the ones that are looking at that from that view, from that perspective. Like, not just, I don't want to just solve this one problem, but how does this problem now streamline down river and solve multiple problems down?
Right, exactly. Yeah. I know a lot of tools promise efficiency, but create new friction, extra logins, disconnected systems, poor integration, and also buy-in, from the users. How do you think about integration early on when building Mechi? I mean, what did you absolutely not want to get wrong?
The people, the people side of it was very, very important for us. And again, we can build all the software tools that we want, but if we don't invest in the people that are actually going to use these tools, we're wasting our
Right,
time. Right.
right.
So it was very, very important for us to build a software that can support the workflows of a let's address burnout as a clinic efficiency issue, right? If your physicians, if your nurses, if your front desk staff, they are burned out, I don't care what AI tools you got, they are not gonna use it,
That's
right?
right.
And case in point, I'm just gonna throw out some numbers at you and the audience, okay? Physician burnout cost in the US alone healthcare system is approximately $4.6 billion annually.
Wow.
Okay.
Staggering.
In a recent article by I think it was Schanefeld, and
Hmm.
her colleagues, they found that like 45 to 52% of physicians and clinicians reported symptoms of burnout. So this was something that was so paramount to us, and saying, okay, if we're building a system that's going to really solve for burnout and improve clinic efficiency and improve workflow and throughput, what does that actually look like to combine a software with the human experience? And so
Right.
to us, that's where Mechi really balances this whole element of, okay, we'll come to your clinic, we'll say, sure, we know you got all these other tools that you're building, but how are you actually thinking about the people, right?
Hmm.
Give us your staff. We will embed, onboard your staff onto our platform. We would then introduce the human side of it, which is let's assign a community organizer for your team and say, okay, 20-30% of your nurses like soccer, 15% like baseball, 10% like bowling. Okay, well, Mechi is not just a software that's going to make it more efficient for you to engage in these behavior, but we are also going to assign an actual human being in real life. And I think that's what's so crucial in technology and this day and age with AI and healthcare. You have to be thinking, how do I take a human being and use AI to augment that interaction and that experience? So early on, from the get go, Mechi had to be that platform. And I said, okay, we are going to come to your clinic. We know your nurses are probably working to the bones. We know you are invested in them. You're spending thousands and millions of dollars to hire and train. Case in point, it costs approximately $500,000, $1 million to replace one physician,
Yeah. Yeah.
right?
Wow.
And so wouldn't it make sense to keep him, to do whatever you can to keep him on board? That's it for us. Was like, I know that if that physician goes and plays tennis once a week after the shift ends, they are less likely to be burned out. They're more likely to stay onboarded, more likely to make mistakes, which are going to lead to claims, which affects the underlying of the business. I think you kind of get picture where I'm going with
Sure.
it.
Absolutely. Yeah.
Yeah.
That's very good. Well, Marty, as you scale Mechi, what metrics or signals tell you you're on the right track? Is it user engagement, appointment recovery rates, or response times, clinic retention? What is it?
Yeah, I think for us, the main thing is retention. For one, would be
Hmm.
a key metric that we're measuring, and two, NIH actually just published an index that you can actually use to measure well person. It's called Well Person Health Index. It's a series of questions that you can pretty much use as a check-in point for your employees to see kind of where they are from a healthcare perspective, from a just overall health and well-being. And it's such a powerful tool that if used correctly, man, we can really truly make a difference in healthcare, not just for the lives of our patients. Because what we forget is we see patients in clinic and we don't realize that this patient is a CFO somewhere, is a CEO somewhere, right? And so these things, they trickle on into the community. And if we can make an impact in their life and say, okay, this one tool that, oh, by the way, my clinic uses this, we use it, we use Mechi, go for cycling every Sunday. And after the cycling event ends, every 3 months, we do a wellness check-in directly on the platform. And then over time, a agent can actually help and show you different trajectories. Like, hey, actually, your health index score is starting to dip. What's going on with you? Do you need to talk to somebody? Right? So
That's
then
right.
that's when we really start to leverage and say, okay, these are resources that exist in the community. How do we connect our user with those resources? So
Right.
obviously with any software, right? Any system, you always want to look at traction. That's obviously a KPI that we're looking at. Less turnover in adopting our platform, burnout rates, which you can certainly capture that, right? And then the health index score. Those are all things that are all embedded that we can capture and give you back to you so you get a better sense of like, oh, this is where I stand. My people not doing good. Maybe, we give them a little bit time off. It could be as simple as that.
That's very good. Yeah. Well, as a founder, how are you thinking about balance between product innovation and distribution? What feels like the harder problem right now? Is it building deeper AI capabilities or educating the market?
I think it's more educating the market. I think, again, the talent is there to build pretty much really good platforms right now, but it's educating the market, is actually going out and selling it and actually bringing the product you built to show value add to people, right?
Right.
Again, to me, my key thing that I want to be able to show a clinic is Mechi as a cost containment solution. For self-insured employees, for example, and like in health systems, their priority is the less claims our employees submit at the end of the year, the less we pay in insurance coverage for those employees, right? Evidence shows that what workplace wellness programs show an average return of about $3 in a dollar spent. Okay.
Okay.
And about $2 in ROI and $1 spent in absenteeism. All these trickle down to return on investment, right? Chronic diseases, for example, was shown to be the cause of like 75% of healthcare spending in the US. That was in 2023 alone, right? And so really stepping back and looking like, okay, how are we really integrating into systems that already exist, make them a little bit more efficient without losing the human aspect? Again, when it comes to healthcare, especially with nurses, there's a reason why nursing is one of the most trusted professions in the US, almost 10 years running now. Don't
Right.
quote me in that. My numbers could be but I know we're close to 10 years and then some, right? Why? Because there's that human side to it. If you can connect that human side, build whatever AI tool you can build, but bring it down to the human level. Dumb it down. The average person doesn't understand the tech stack. The average person doesn't understand, like, oh, AI is not some secret, you know, thing that's like is gonna steal all my life and all my. It's just when the internet first came out, most people didn't want to get on it. I think bringing it down to that level to the average person is so fundamental to the success of any AI product that you're building.
That's good. If we look 3 to 5 years out, what does a fully optimized clinic look like through your lens? I mean, what's automated, what's human, what disappears entirely?
Yeah. Automation for me, the way I see it in clinics, scheduling, for example, I wouldn't say it would be eliminated completely. Again, 5 years might be a little bit too soon to truly replace that level of that human interaction. Like to say, okay, you have all these complexities. Oh, my insurance changed. So now I got this. So there's like that extra layer, that I feel a person could just navigate a little bit better than an AI
Sure,
agent would, for example, right?
sure,
But that's not to say it's not possible. I just don't think it's gonna happen in 5 years. I do think, though, there are some redundant workflows in clinics that AI can replace in 5 years. For example, one of my biggest pet peeves as a provider is having to file paperwork for a prior authorization for a medication to be covered by insurance. Even there's a plethora of research out there that has already shown and backed it up that the first line or second line treatment for this condition, for example, when Entresto became pretty prominent in the market, working in a heart failure clinic at the time, and I can't tell you how many prior authorizations I had to fill out per week. I would say at least 10 to 15,
yeah,
right? That's countless hours that I've spent to do something that was so redundant versus spending time at the bedside with the patient,
sure,
which is that human
absolutely,
aspect, right? So automate some of those things. Automate the scheduling. I see AI automating some of those like workflows, like maybe billing, for example, right? Like as I'm taking or I'm talking to the patient, the documentation or like initial capture of the H&P or the history physical, right? That's something that I actually see AI essentially doing and replacing. So right now we have we have some roles that people that actually do that. They call them scripts, right? So as a physician in the room, or the doctor, or the nurse practitioner, or a midwife, or whoever is a clinician, they're just talking with the patient. It's the scribe's job to actually try and capture all the relevant medical information. So the clinic just runs a little bit more efficiently. I do see a huge value add and potentially a replacement of that role by an AI agent, right? Or a tool that is so powerful that can capture and pull in evidence-based data, for one, that's readily available on the internet. A lot of guidelines all live on the internet now, right? So pull out AHA guidelines, first line treatment recommendation for, I don't know, first degree burn, for example. It could literally pull that up. It can listen to our conversation and say, okay, oh, it sounds like you and the patient were talking about, first degree burn, blah, blah, blah. This is what the recommended, right? Again, I always will echo one of my supervising physicians and mentors, which is guidelines are guidelines. Ultimately, you treat the patient. And so that's why I'm saying there will always be the human side of it, right? The
that's
guidelines
correct,
exist, the data is out there, but then again, the data is only as good as the sample, right? And not every patient, no two patients are the same. So you always treat the unique patient. Sure, general population will fall under the bell curve, but there's edge cases that you have to look out for. And we don't miss those people so they don't fall through the cracks.
absolutely. Well, that sounds fantastic. Well, Martin, I think this has been very insightful
Thank you.
and incredibly valuable. I really appreciate your time and your openness, and I'm sure our audience will enjoy it as well. Thank you so much, Marty.
Absolutely. I really hope so too. And thank you for having me. Again, in closing, Martinien Cho, CEO co-founder of Mechi, where the most advanced AI systems in the world still would depend on healthy humans to use them, right? If we optimize the workflow but neglect the workforce, efficiency will always be temporary. I'm just going to leave
Right.
it at that, right? So if we're building efficiencies, we should be thinking of the people that are going to be using it coming down the road. And that's what we're here to solve.
Absolutely.
So thank you
Absolutely.
for
Well,
having
thank you so much, Marty.
me. Cheers.
Yeah.
Thanks.